Today, Jess and I are doing episode 3 of our series on common interventions during labor and birth. And today's topic is yet another polarizing one.
Yeah.
It's the Hep B vaccine. And the only reason we cover this vaccine is because it will be offered to you if you give birth in a hospital before you leave. So let's talk about Hep B. What is it? What are the chances of, let's just kind of pick it apart.
Yeah. So hepatitis B is a bloodborne disease. The biggest route of transmission is through unsafe sex, through IV drug use, really things that babies aren't doing. So the only way that a baby is at risk for hepatitis B is if their mom happens to be hepatitis B positive, or if for some reason they need a blood transfusion. There is a chance that someone with hepatitis B that they didn't catch on the tests could have donated blood. Other than that, baby is at zero risk for hepatitis B. So a lot of people ask, well, why are they giving this shot in the hospital then? And I feel like that is there's like political reasons why they're doing that, and then there's also, which we'll talk about it with some of the other common interventions, it's also because even though you're tested for hepatitis B early on in pregnancy, it's kind of like the doctors don't know you, they don't, so it's kind of like one of those public health things that they're like, well, we don't know what you've been doing since we tested you for hepatitis B, so maybe you weren't positive 6 months ago and maybe you are now, one of those kind of things. So really, if you know that you are not at risk at hepatitis B, and also there's a lot of really great information about how effective the hepatitis B shot is even for moms that are hepatitis B positive. That's not a subject we can really get into or have time to get into here. But if that's a question that people have, send us a private message or whatever, and we can send you those studies and that information privately so that you can have that information. But it's still even an option to decline even with a hepatitis B positive mom. I'm not saying that you should, but you should look into that information for yourself to see whether the benefits of the hepatitis B vaccine outweigh the risks, because although we are very often taught that the risks of vaccination is small, there's never a 0% risk to any intervention.
So I think it's important too to outline the fact that this was introduced in 1991.
I think was when they added
babies. For babies. I know most people, at least in our generation, didn't get it until middle or high school. It was not available when we were younger. And it's also important to note that if you do choose to vaccinate with the Hep B vaccine as a baby, your child will have to have a booster or be revaccinated
around middle school.
Around middle school when they actually become at risk for some of these things, because by that point the antibodies have worn off.
Yeah, they don't last until, so they figure, well, we'll give them to babies to catch them before they're doing the at-risk behaviors, but they're finding that those antibodies that are induced by the vaccine actually wear off by the time that child's a preteen, so they have to do a booster anyway. So there's several options that you can do with the hepatitis B shot. So you can just decide, well, hey, I am fine with the vaccine and I'm not worried about the risks. I'm just going to give it to the baby at the hospital and go along with CDC regulations. Or you can decide that you want to do it privately with your own pediatrician, and so you can either add it in at their 2-month vaccines, or you can wait and give it to them really at any time in their childhood. You could decide to start doing the hepatitis B series. You could wait all the way up into adolescence, or depending on how you feel about vaccines, you have the option of not giving that vaccine at all. So really there's a lot of different options for that. So we really suggest looking into that and really asking yourself, is it really necessary to be doing this intervention before leaving the hospital when a baby's so new?
And their immune system is pretty, at risk.
There's a lot of stuff they're getting used to at that point in time. So if you have any questions about that, like I said, send us a message and we'll send you any information that we have so that you feel like you're making an informed choice. And when it comes to vaccines, I always tell people, do all your research and keep doing your research until you feel comfortable either way. If you're still feeling nervous either way, then you haven't done enough research. So if you do all your research and you want to vaccinate, that's great. Just do the research and feel confident in that, because you and your baby are the ones who are going to have to deal with the consequences, not the doctors. So, yeah.
Right. And we should say consequences either way.
Either way, consequences of vaccinating or consequences of not vaccinating. So it's a big decision. So don't be afraid to research it and to really make sure you feel comfortable with it
with your decision
before you do it. Yeah.
Yep. So guys, thanks for joining us again, and we will see you again next week. Bye.